Good afternoon, everybody. I'm Sayukta, your host for today's live from All About Skin Wellbeing team. And I'm sure all of you must be keeping good health. Today, we are going to discuss about psoriasis, a condition in which skin cells build up and form scales and they itch a lot. They are like dry patches. Psoriasis is thought to be an immune system problem. Triggers include infections, stress, cold, etc. The most common symptom is a rash on the skin, but sometimes the rash involves the nails or joints as well. It can start at any age, but most often develops in adults between 20 to 30 years old and between 50 to 60 years old. It affects men and women equally. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about skin conditions, how we can prevent it, the kind of test required for the diagnosis, and the right treatment and management approach for an early relief. So today we have with us renowned dermatologist, Dr. Shobha Reddy, who is a dermatologist from the Suknagar, Hyderabad. And she has an experience of 15 plus years in this field. Dr. Shobha Reddy practices at Dr. Shobha's Skin and Hair Clinic in Suknagar, Hyderabad. And there is one more clinic by the same name, Dr. Shobha's Skin and Hair Clinic at Mehdipatnam, Hyderabad. She completed her MBBS from Gandhi Medical College, Hyderabad in 2008 and DDVL from the same college in 2010. She is also a member of Indian Association of Dermatologists, Venerologists, and Leprologists. Some of the services provided by the doctor are line and wrinkle smoothing, scar treatment, chemical peel, cosmetic treatments, and laser hair removal, etc. A very warm welcome to you, Dr. Shobha Reddy. It's such a pleasure to have you with us.
Thank you. Thank you for the nice intro.
It's such a pleasure to have you with us, doctor. And again, this is such an important topic, psoriasis. Normally we take our skin infections, allergies, etc. so for granted, and we kind of, ignore it and try so many hidden trials on it. So it's better that we spread awareness on the very same issue, which is psoriasis. So today we'll talk on psoriasis. Again, psoriasis is a kind of skin condition where you see some rash, and it is triggered by a number of things. It could be triggered by a number of things like infection, stress, cold. Psoriasis is thought to be an immune system problem. So viewers, if you see any rash on your skin, please don't do experiments, don't try home remedies, don't go for over-the-counter treatments. Go to a qualified doctor, and we have with us Dr. Shobha Reddy. So first of all, doctor, what is psoriasis?
See, one thing is when this like diabetes and hypertension, psoriasis is also one of the very common chronic disorder.
So, yes, doctor.
So like diabetes and hypertension, we have to treat it continuously, not like just like treat for some days and we have to stop the treatment. You have to maintain it continuously. And visually, if you see the psoriasis, as she said rightly, they are very dry, scaly patches, and sometimes it may be bright red. So sometimes it's like fish scales. That's why we'll call it as psoriasis. That is, psora is like a fish scales. So this creates a lot of cosmetically embarrassment for the patient, especially for the younger generation. And not just this one, even if you neglect the psoriasis, it may lead to the disabling, like even it may involve the joints also, and it also involves other parts like nails also. So overall, psoriasis is not just the skin disease, it involves the nails, even the joints, and other body parts like even the scalp hair also. So although psoriasis is not very symptomatic, cosmetically it causes a lot of social discrimination. So try to diagnose it early so that we can treat it properly.
Right, doctor. And as you said, it's important to diagnose it early. So what does it look like? How to determine for a layman, how does it look like so that we know that, okay, this is psoriasis and we need to go and consult a dermat?
Yeah. See, ideally, psoriasis, as you said, it looks in 70% of the cases, it looks like a bright red, the pink patches and the scaling. But it's not compulsory that every patient will have the same lesions. It may be seen as a very small patches, like small gutted lesions. And sometimes it just involves the scalp also. People will confuse with the dandruff. And so they will keep on treating the dandruff as it is as a seborrheic dermatitis. So ideally we can say scaly patches, red scaly patches. But the thing is, if it is causing more itchy, it may be mixed with the infections also. So when you have the doubt, always, because psoriasis is a very common condition which can be misdiagnosed. So when you have the doubt, consult the dermatologist, proper skin physician, so that they can diagnose you at early stages.
Okay, doctor. And doctor, what causes psoriasis?
See, as such, psoriasis doesn't have any exact reason. This will cause the psoriasis, like many skin diseases. But the thing is, see, as it is running in the families, so many, if you see in both mother and either mother or father having the psoriasis, children are getting the psoriasis in children is very common. That's why, yeah.
Yes,
so genetic predisposition is one of the common thing. And second thing is like other vitiligos, like how we will see the white patches. This is also considered as one of the autoimmune problem. So when you see the like the vitiligo, this is also one of the autoimmune problem. That means small inflammation or your own autoantigens are acting against your own body. And sometimes there is no reason, just an external factor, simple trauma also will aggravate the psoriasis. So as such, there is no exact etiology for the psoriasis.
Okay, doctor. And do people who have dry skin are more prone to psoriasis?
Yeah, atopic skin, that's what you said, dry skin, they are more prone to psoriasis because they have high chances of trauma. So that trauma will aggravate the psoriasis.
Right. Now, when a person comes to you, doctor, with any skin infection or allergy, etc., I mean, for the patient, it must be just a rash. But when the patient comes to you, how do you diagnose and find out that, yes, this is psoriasis, just by clinical investigation, or you also do some tests, etc.?
See, by our experience, we can diagnose psoriasis in 70% of the cases. But if it is superimposed with some other infections, already they have taken a lot of treatment previously with other specialties, it may be confusing. Most of the time, psoriasis can be misdiagnosed as a fungal infection. They will keep on treating for the fungal infections. So in that conditions, it may be confused, but otherwise, psoriasis is a very clear-cut picture. When you have diagnosis, especially when you see on the elbows, knees, with a typical scaly patches, we can diagnose it easily. But when you see some unusual sites, flexure area, especially in the women, if you see the inframammary area, groin area, you have to think in a out of the box, and it may be intertrigo superimposed with the psoriasis. So there is a chance of having psoriasis mixed with other infections also quite common.
Okay, doctor. And doctor, what are the treatment options available for psoriasis?
There are so many options are available, but it depends upon the severity, whether they're having very mild component just involving the elbows, knees, or just involving the scalp. We can go for the topical medications like creams, good moisturizers, and immunosuppressive creams like steroids or other topical immunosuppressive. Even the vitamin D based creams also helpful. But if it is more prolonged disease, and if it is not responding to the topical creams, then you have to go for the medical oral management with the advice of the dermatologist. One most important thing is a phototherapy. This is a very advanced thing, and it is quite useful for the psoriasis, like a vitiligo. How we'll treat the vitiligo for the white patches? In the same way, phototherapy is very useful for the psoriasis, because here we are trying to reduce the scale thickness. At the same time, you are reducing the autoimmune component also. So overall, we can say it is as a medical treatment, topical treatment, and phototherapy.
Okay. And doctor, is it contagious?
It is not contagious. People will think that psoriasis may spread from person to person. So always boost up the confidence of the patient, because most of the time they will stay away from the same members in the family. So this is very important. Teach to the patients, at the same time to the family also, that it is not contagious at all. Like diabetes and hypertension, it is not going to spread to other person. It all depends upon your internal factors like obesity and other issues. But if you see on the scalp, if it is infected with the fungal population, that time this may spread from person to person. Otherwise, psoriasis is not at all contagious.
Fair enough. And doctor, a very big concern for the patients of psoriasis is that will it ever get cured permanently? So is it curable?
See, psoriasis is a genetic disease, which I told previously. That's why we can't remove it completely from our body. But yes, 100% we can make the patient symptom free. We can almost all the patches can be disappeared if you use the treatment properly, if you diagnose early, and if you don't do the misdiagnosis. That is very important. That's why whenever you have the doubt, whenever you see any scaly patches, whenever any non-itchy condition coming on your skin, better to consult the dermatologist as a first visit, not going here and there and jumping after happening something, you're coming to the dermatologist, it will little late. So psoriasis can be kept completely disease free or even symptom free if you diagnose it early and if you use it as a maintenance treatment.
Right. And what makes psoriasis worse, doctor?
Yeah, there are so many conditions which can make the psoriasis worse. Even the simple trauma, even the nail bite or even nail mark also sometimes may aggravate the psoriasis. And some people, even the seasonal changes, some people they will get more psoriasis and more of psoriatic patches, or they have more symptomatic in the winter, and some people it may aggravate in the summer. So even the seasonal changes that also vary from person to person. Not for every person will get more psoriatic patches in the winter, and some people will get more in the summer. And the second most important thing which is neglected is the obesity and the lifestyle things, like stress, acute stress, not controlling, not following the good healthy lifestyle, that also will aggravate the psoriasis. So all these things are very important, not just the external factor, even your internal health is also very important to treat your psoriasis.
Right. And as you just mentioned, that taking care of your internal self, your health is equally important to prevent psoriasis or in, treating psoriasis. My question to you is, doctor, that what lifestyle modifications we can do, what, healthy way of lifestyle we can follow to prevent psoriasis?
Yeah. Treating the psoriasis as a lifestyle is very, very important, because most of the people, they don't know is psoriasis is the inflammatory disease. So what is inflammation means, it will happening under the skin, that is the reason for the psoriasis happening continuously. Same thing it may happen even the cardiovascular tissues. That is the reason people who have psoriasis, they have a high chance of getting stroke. So always treating the psoriasis as a metabolic issue is very, very important. Treating the obesity, treat as a obese, how we'll treat the obese person. There is no shade that if you have the psoriasis, if they are obese, and if the BMR is high, if they are morbid obese, better to consult a dietitian. Take the proper lifestyle, treat it as a lifestyle disease, and you can do for stress relieving thing, you can go for yoga or whatever is comfortable for the patient.
Right. So lifestyle modification is very important. Taking care of your health is very important. Taking care of, checking your weight gain, etc., is equally important. Now, doctor, as we were talking initially, that many times what happens, that's a kind of tradition when we have in our society. When we get something which is not normal on our skin or scalp, rather than going to the doctor, we try some home remedies, or we go for over-the-counter medication, or we'll ask a family or friend. I'm sure you also get patients of psoriasis who have wasted a lot of time in, trying all these. And by the time they land up in front of a doctor, it's quite late, and the treatment, etc., becomes more lengthy, it takes more time. Now, do these home remedies actually work?
See, actually, psoriasis is a simple disease. As you rightly said, before coming to the dermatologist, they will use all the most possible home remedies, and they will go to other specialties, and they will use whatever is possible. So this will complicate the diagnosis, and also at the same time, whatever the management which we have to start at the beginning, we have to go for the medical management in some patients. So always treating the disease early is always beneficial. But once they come little late, maybe infected, or maybe secondly infected, sometimes it may result in other infection. That times we have to go in a proper approach, and sometimes we may need other medical management, like even methotrexate also, because it won't respond with a just topical management. That times we have to go for the other oral immunosuppressives like methotrexate, aracitrate, and all those things, but with a proper blood checkup.
Right. And again, over-the-counter medication is so common because it's so easily accessible in our society. So people will just go to a chemist shop, get some, topical cream or something and start applying it. Again, unless and until the symptoms get worse and it becomes, out of control, that's when they'll go and approach a doctor. Now, what are the side effects of applying these topical creams just by, over the counter?
See, in India, most easily available cream is, everybody knows, is a steroid cream. So as soon as they go, whether it is a fungal infection, whether it is a psoriasis or any other patch, they will start either a normal steroid or a combined steroid cream with other antifungal or antibiotic, any other cream. So it's some, in the initial stages, they may get the response, but as the day progresses, if it is a fungal infection, it is going to aggravate. If it is a psoriasis, it may regress for some time, but it will aggravate sooner. So always, so when the patient comes to you, tell them to stop the treatment, whatever they are using, even though if they are not willing, because people will think that it is responding, so why we have to stop. So, but as soon as they come to the dermatologist, it is our responsibility. It's our dermatologist responsibility to stop the treatment, to stop the steroid creams, because otherwise, if you don't stop now, how the infections are going to reduce, it is very difficult to reduce. So always tell the patient to start from the routine management, like a topical steroids, with the advice of the dermatologist, not with the chemist. This is very, very important. And one more thing, if it is not controlling with the steroids thing, we have to go for the oral management.
Okay. So we are talking about psoriasis and how it's caused and how to take care of it. And one important thing that you have already mentioned, doctor, is that family history matters, right? Now, for a person whose parents or one of his or her parents has the history of psoriasis, what the person can do to as a preventive measure?
If it is running in the families, first thing we have to ask, how is their skin condition from the childhood? As you said, extremely dry skin people are more chances of getting psoriasis, because there is high chance of scaling, and at the same time high chances of trauma for the dry skin. So from the childhood, if you are able to diagnose the dry skin, that is atopic skin, with a good proper moisturizing creams and even the good bath care, even the avoiding the unnecessary traumas and avoid unnecessary things like using other creams for unnecessary things, we can avoid to some extent, we can prevent to some extent. And second thing is just modifying the lifestyle is also very important, because if they are obese in the family and they have the history of psoriasis, better to keep them in a good lifestyle, good healthy lifestyle, so that in future, if they get psoriasis also, it can be controlled in a easy way. Just not going for the medical, we can control with just with a topical management. And if it is running in the families, if you are able to see, one important thing is, if the parents have the psoriasis, one advantage for the kids is they can diagnose it early, and they can, if they able to bring the kids as early as possible, whenever they see the skin is small patch, if they come early, it's very easy for us also to treat completely. So so in future they don't get use the medication for continuous lifelong. So that is one advantage. The only thing is parental education is very, very important for this thing.
Okay, doctor. So we have one viewer with us, Ravi, and Ravi's question is, what are the most common triggers for psoriasis?
Yeah. See, common triggers I already told, but the thing is, avoiding the trauma is very, very important. In the children, avoiding even the small infections also very important, because even some people will have throat infection like pharyngitis. There they may get psoriatic, get flared. That means it will be increased. It may spread all over the body. And second thing is, in the middle-aged people, the smoking and alcohol, the most risky factors. Tell them to avoid especially the smoking thing. It will flare up the immune component, autoimmune component. At the same time, it will flare up the inflammatory component also. So, see, in simple term, we can say infections. Second thing is a stress, and third thing is a smoking, and fourth is a lifestyle disease.
Right. We have one more viewer with us, Neha Dugal. Neha's question is, can any medication that I'm taking worsen or interfere with my medication for psoriasis?
Yeah, some medication like antihypertensives, like beta blockers, even AC inhibitors, some may flare up the psoriasis, but as they are life-saving drugs, we'll tell the patient to go to the physician and change to the alternatives, because they are very important things. But some things we can avoid. Something like even antimalarials also previously used to give psoriasis, but as of now we are not using that many hydroquinone derivatives. So only thing is, some common medication we have to train to the patient so that they can go to the physician, they can go for the alternatives.
Right. And that makes it even more important to go to a doctor and consult a doctor and not to go for over-the-counter medication or do home remedies, etc. So please don't waste your energy, your time, your money, and most importantly, your health. Don't do that. Go to the doctor at the very first phase whenever you see something which is not normal on your skin, scalp, etc. And as you were saying, doctor, that psoriasis does just not restrict to skin; it can spread on your nails as well, joints as well. So we would like you to shed some more light over psoriasis of nails and joints.
Yeah. See, one important thing is, if the nails are infected, means disease is almost moderate to severe component. And one important thing is, as nails are growing they grow very slowly. So you're not just applying the creams are not going to help you. Nail psoriasis, we can treat as a moderate to severe component. There, if you start the oral medication like acitretin or even methotrexate, and some people who are affordable, they can go for even cyclosporine also. It's for this type of patients, nail psoriasis will come under control. And second hint is, when the people are having nail psoriasis, there is a high chance of getting psoriatic arthritis. So this is we can consider as one of the hint. So nail psoriasis, never neglect, and never misdiagnose with the fungal infections. See, even the fungal infections also very common, that also affect the nails very commonly. So try to don't misdiagnose the condition, and that is very important.
Right. So, and many times people will ask, can the sun help in the case of psoriasis, and how does it help?
This I explained. See, because sun is not going to help for every patient, because even the psoriasis, every person will have one trigger. Not every trigger will work. Every trigger will flare up the psoriasis, because some people, psoriasis will be more in the winter. For those kind of patients, sun will help. But some people, if they go outside, they will get lot of psoriatic, maybe because of the extensive sweating also. So sun is going to help only in few patients, and sometimes it may aggravate. It depends upon, it varies actually person to person. That's why history taking is very, very important in psoriasis.
Okay, we have few more questions from our viewers. I'll take them one by one. So Kavita Milinda's here. Her question is, what side effects should I look out for from my psoriasis treatment?
As we, if it the milder component, will generally will go with the topical creams only. The one thing is, don't use a steroid not more than the prescribed time by the dermatologist. See, most of the common mistake what will happen with the steroid creams is, even though dermatologists will write use it for 10 days, they don't use for 10 days. They may extend till 20 days also, because they are getting the response. That's very bad. And steroids have to be used prescribed time by told by the dermatologist. That is one thing you have to avoid. And the second thing is, you can go for other topical immunosuppressives that will be suggested by the dermatologist. And the third thing is, if you are not able to control just with the topical creams, you have to go for the medical management. So medical management, it depends upon your extent of involvement. See, and depends upon your age, and depends whether you want to conceive, or depends when you want to lactate. All these conditions will help. All these conditions will we have to take into consideration. So say as such, if you consult the dermatologist, they will see according to your skin condition whether you need medical management, whether you need topical treatment, or whether you just go for phototherapy. So if you consult the dermatologist, and if your proper visits are there, we can avoid most of the side effects.
Right. And that's why it becomes even more important to go to the doctor, as we are continuously repeating, because it's very important. When you go to a chemist or try some home remedies or ask a friend or family, they'll just advise you on a very general way. They won't take your history in consideration before suggesting anything. So please don't do that. Don't make the condition worse. Don't make your symptoms worse. Go and contact a doctor. That's really important. And many a times, the notion that we have in our head, doctor, is that we'll save on money, we'll save on time, we won't have to go for appointments, etc. But ultimately, if we see that we end up spending more time, energy, money, and also compromising on our health. So that's really not advisable. Go to the doctor first. I'll take a few more questions. So we have Mini Ahuja with us, and her question is, what can I do on my own to take care of my psoriasis?
On your own means the first thing as a patient you have to take is a good moisturizers. And that moisturizer also you have to consult the dermatologist. You can't take your own moisturizers because it depends upon your skin nature. If you are very atopic skin, you have to go for a good moisturizer which is ceramide based. And if you have very deep cuts on the palms and soles, you have to go for the urea based creams. So even the moisturizer choice also depends upon how your psoriasis severity is there. So on your own, what you can do is avoiding the trauma and use a good moisturizers, use a mild cleansers, because even the harsh cleansers also may flare up the psoriasis. And one more important thing is treating the scalp psoriasis almost 70% depends upon you only, because proper cleansing of the hair is a very, very important thing, is frequent washing and using the proper anti-dandruff shampoos on and off. If it is very thick scale based, coal tar based shampoos, that too with the consultation of dermatologist is always important. So on your own, what I can say is avoiding the trauma, avoiding the stress, maintain a good healthy lifestyle, maintain your body weight, and proper cleansing of your scalp, and good cleanser, mild cleansers. These are important on your part. And this is a very good question also, because people will think that as a dermatologist has written some creams, if I use these things, it will be controlled. No, this is not true. Like the diabetes, how we'll advise, even the hypertension, how we'll advise to go for the healthy lifestyle. This is also treated as a chronic lifestyle disease. So it's a 50-50. How the dermatologist will treat you, you also treat yourself. You know your skin better, right? So because you will see your skin every day.
Right. And we have one more question from Kirti Deshmukh. Her question is, what is psoriatic arthritis?
Psoriatic arthritis, if it is, we think that only mild joints are affected, like hand bones and feet bones are commonly affected. But rarely it may involve the knee joints also. It may involve the backbone, that sacroiliac joints. They are very alarming things because they're very disabling. It reduces the quality of life of the patient like anything. See, just imagine your backbone is involved, sacroiliac joint. If it is diagnosed late, it's very late. If you diagnose late, if you come by the time come to the dermatologist, almost bone is involved, it's a very difficult to treat. So that's why whenever you see the psoriasis, especially if you see the psoriasis from the childhood, if it is running in the family and with a nail component, always think in a way that it may affect the bones also. So it's not just a skin disease, it may involve the bones also. Although rare, like knee involvement and sacroiliac backbone, always think in mind, think out of the box and think it may happen. So always go for the proper checkup like x-rays and even the MRI spine. See, something which we cannot diagnose by seeing the naked eye, we have to go for the investigations. And if you have any doubt, better to consult the rheumatologist also, because sometimes even the large joints, maybe even the rheumatoid arthritis also, where is one of the possibility. So psoriatic arthritis is not, it's not a standalone disease. It may be combined with other mixed connective tissue disease, even with other bone disease also. So always holistic approach is very important for psoriatic arthritis.
Now we have Farid Sheikh, and his question is, what is scalp psoriasis?
This is very, very important, because scalp psoriasis standalone won't exist. It is always combined with a dandruff, that is seborrheic component. Why? Because our hair is fully rich of fungal population. So when you are treating the psoriasis, it is a very tricky thing when you are treating the psoriasis and the scalp base. Why? Because it is always combined with the fungal population. So the seborrheic component will be more dominating. So try to treat both the seborrheic component and psoriasis at the same time. See, if you see a lot of greasy, small hints for the patients, and if you see the greasy scales, try to treat it as a dandruff first. Then will progress with the psoriatic treatment like coal tar based creams. If it is not responding, we'll go for the oral methotrexate, because scalp psoriasis is a very difficult, and because it's a routine maintenance is very, very important, not just the oral treatment like methotrexate, even any other medical management. Without your care, without your proper cleanser, it is very difficult to reduce your fungal population on your scalp. So treat as a dandruff first. If it is not controlling, then treat it as a sebo-psoriatic component. Then you have to treat it as a proper psoriasis.
Right. Most important thing is that we need to, take care or consider these things. Normally, what happens, doctor, whenever we see, dry scalp or dandruff, it may be due to something else, or the reason could be various. But then we feel that it is because our scalp is dry, and we start putting a lot of oil on our scalp. Many times it aggravates the, symptoms, etc. So, what's your advice on that?
See, most of the time in Indian scenario, they'll treat it as a dandruff only. They will use all the home remedies, which will actually worsen the psoriasis. They will use menthol powder or some other nimbu and whatever is possibility. So these things will aggravate the psoriasis component on the scalp. So whenever you have the dandruff, it is not responding with the topical things or normal conventional treatment, and whatever you are using, this may not be dandruff. Think beyond the dandruff, and it may be component of psoriasis also.
Okay, we have Lalit Sharma with us, and his question is, how long will I need to treat my psoriasis? A very common question.
It involves it. It depends upon how much area of involvement is there on your body, and how many years you are suffering from the psoriasis, and how best you are taking your routine care. These three things are very important, and nothing like there is no topical medication you can take with the advice of dermatologist. But the thing is, proper moisturizers and other body parts and proper cleansing on the scalp are the two things I can say. So these two things are the basic things.
Okay, and we have Ishita Mendirata with us. And Ishita is asking, are there certain foods which I should eat or should avoid eating?
Yeah, certain foods. As such, we don't suggest to avoid any food, but the thing is, try to avoid the fatty food and try to avoid some things which will aggravate your atopic condition, that is dry skin condition.
And as you said initially also, because, the people who have dry skin are more prone to psoriasis. So moisturizing our skin regularly, religiously is one thing that we can do, right, doctor?
Yes. Good moisturizer is a very basic core of the treatment for psoriasis also. Like atopic, if you treat the psoriasis also from the childhood, if you treat it as skin as a dry skin, there is less chance of getting psoriasis get aggravated.
Okay, but then with all the market gaming, and there are so many products over the counter, we have so many, moisturizers which are perfumed, scented, and they are actually full of moisturizers from various brands, etc. Now, how to choose the right moisturizer? Do we always need to go and consult a dermat for that, or we can do it on our own as well?
I suggest to go for dermatologist, because always analyze your skin, whether it is a dry skin or combination skin, or even very oily skin. And it also depends upon the age, at which age you are going for the treatment. See, some people, if you are pubertal age, we have to choose a moisturizer which cannot cause acne, which should not make their skin more oily, or even other body parts also. So, but for the psoriasis, always go for the good thick moisturizer. Basically, ointment-based things like a thick formulations are always beneficial, especially for the feet and hand. Go for the ointment-based things. For the face, you can go for the cream-based formulation. For the whole body, you can go for the lotion formulation. So these three things are very important, whether which body part you are using the moisturizer and what age you are using the moisturizer. And we can't use the urea for the face, right? So same thing, urea-based creams we can use for the hands and feet, and the same non-comedogenic moisturizers for the face, even the back also, because there are high chance of getting acne at that part. So it always better to, at least for the first visit, if you consult the dermatologist, they will suggest. See, the compositions are so confusing. As you rightly said, so many scented free, scented, preservatives free, ceramide based, so many things you don't know the technical thing. So to some extent, dermatologists guide you.
Right. And one last question from viewers is from Mahi Kapoor. Will psoriasis cause other health problem?
Yeah, previously I told that thing is always think out of the box and think beyond the psoriasis, think beyond the skin, because what is happening on the skin, same thing may happen in other body parts also. What is happening in the skin is a very mild inflammation. Same thing may happen in the blood vessel also, and that's why the atherosclerosis, what is the main reason for stroke, it may be aggravated. So people who are obese, people who have the family history of stroke in their grandparents or anything, we having psoriasis, always think about the cardiovascular issues. Tell them to go for the fasting lipid profile, go for the frequent cardiac checkups, because in some way we can prevent all these conditions in future also. So psoriasis may affect other things also. It's not about the psoriasis, it is a spectrum of the metabolic disease.
Okay, doctor. Doctor, and before we sum up the whole session, any take-home message for our viewers?
One thing is, once you see the psoriasis, don't get embarrassed. It is treatable. Second thing is, don't get secluded from your own family members. Tell them that this is very important, because self boost up is very important. Because most of the time, what I observed, especially in the pubertal age or young age, people who have scalp component, people who have scalp psoriasis, I have seen some people, they don't go for the jobs also, because it's very difficult, very embarrassing. I can't read it properly. People may think what is happening on my scalp, all these things. These are the simple things, but the thing is, people who are really suffering, they will know actual pain. So frequently attend the good dermatologist consultation. At the same time, go for the good proper print media, and go for the good good advice. So all these things will definitely help. And attend any patient campaigns are there, any social awareness programs, all these things will help their confidence levels. And never discriminate yourself from other people. That is very important, because lot of psychological issues will be happening in the psoriatic patients. That as a dermatologist, I have seen so many people, we'll think it's a small issue, but from their point of view, we don't know how much emotional component is it. So just not treating the psoriasis, treating the emotional component is also very important.
Thank you so very much. Thank you so very much, Dr. Shobha Reddy, for your valuable time and advice. It has been a very informative session for our viewers, and I'm sure they'll use this information to prevent themselves and their near and dear ones from getting psoriasis. At least now they know that doing self-medication, over-the-counter medication is not going to work. It's also always advisable to go and consult a doctor. Thank you so very much once again.
Thank you, ma'am. Thank you.
And viewers, thank you for your participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page, all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day ahead. Goodbye.